Cardiovascular disease remains the leading cause of preventable death in the developed world. Most people know that a healthy diet, not smoking, modest alcohol consumption, and regular exercise improve the likelihood of a healthy life. But for some, this is not enough. There are a group of people who suffer from a condition called familial hypercholesterolemia. These people have a genetic defect that results in them having high levels of LDL cholesterol that causes cardiovascular disease. If this condition is left untreated, 50% of men in their 50s and 30% of women in their 60s will develop cardiovascular disease. If the condition is identified, it can be treated with tablets, and the individual's likelihood of developing cardiovascular disease will return to normal risk levels. If someone has the condition and they have children, there is a 50% likelihood that their children will also suffer from the condition and may be completely unaware of the fact that they have a higher risk of developing cardiovascular disease. We aim to set up Guernsey's first genomic screening program led by Dr Mat Dorrian. Forecasts suggest that there may be as many as 250 people in Guernsey with the condition, and we aim to find as many of them as possible in the next 3 years. The key to making the program as successful as possible will be to ensure that doctors refer appropriate candidates, that the public are aware of the service, that all testing and care within the Familial Hypercholesterolaemia clinic is free, and that after identifying a carrier, we can test as many of their relatives and family members as possible. All screenings take place in one of Queen's Road's surgeries and simply involves the taking of a sample of blood which will be tested for the condition. Positive results will then be given in a consultation with Dr Dorrian, and the commencement of an appropriate drug regime will follow, often supported by dietary advice from a dietitian and the adoption of a low-cholesterol diet. We are convinced that with Guernsey's tight-knit local population and the strong sense of family and community, we can make this the most effective familial hypercholesterolemia screening program in the world.